My surgical patient yesterday has been my patient for 10 years. So I got to learn a lot from her, including about filler. This is her first surgical procedure, and we did everything. You'll get to see her photos, eyes and mid-face and an invisible access jawline and really cool procedure upper and lower lids. But I got to learn about her because about 8 years ago, I put filler in her tear trough and mid-face area. That was a couple of years after I had started seeing her for other things. And so I have this really cool progression of photos for her. So before her procedure, just like I always do when I was visualizing, I went through every photo. For her, that's very unique because I had photos that I took from 10 years ago very frequently all the way until now. So I got to see where her lower lids were. She was 49 years old now. So I got to see where her lower lids were at age 40, all the way through literally every year and more frequent until 49. And I got to see where the filler was placed and what that did and how that aged. And so here is what I found, or here is what sort of came from that. 8 years after filler, but with her being like 9 or 10 years older. When I look at the original photos of her getting the filler, made her look better, honestly. After the filler, we have done a few things since then with some lasers and things like that to manage some of the skin aging that was happening on top of the laser. And I will say this, honestly, when I look at her at 49, she looks better at 49 than she did at 40 in her midfacial area. No question about it. So for all the filler zealots out there, yes, she looked better overall in her midfacial area. That does not mean that there were no issues though. And this is what ultimately led us to surgery. When I go back and look at her at age 40, I look and I'm like, you were a great surgical candidate then for what she had: lower eyelid bags, mid-face descent, volume loss, cheek fat pads separating from the eyelid bags. So she was a great surgical candidate then. She got filler instead. Looked better, still looked better 8 years later. So there's your filler lasts, and it does give degrees of improvement. But what was happening was she was getting what I'm calling some percolating, and I'm seeing this in more and more patients, percolating of her filler, which I placed. So I know that this is going against the entire argument that it's poorly placed filler. That is absolutely not true. Her filler is moving from a very great placement 8 years ago into her orbicularis muscle, the muscle that sits around her eye. So this filler was placed where it should have been by one of the best injectors at the time. I'm not calling myself that, but I knew what I was doing. I was very good at what I did. I know the plane it was in. I was not putting it in her orbicularis muscle. It wasn't in her orbicularis muscle for nearly a decade, for 7 years, 6 years, something like that. And then over the past few years, as the filler is breaking down, I'm not saying it doesn't go away at all, but as it breaks down, its properties change and it starts moving. It's moving, and it's moving to her orbicularis muscle. So everybody, all the other injectors out there can say, you just put it in the wrong place or whatever. And I'm like, it was sitting in the wrong place for 6 or 7 years and did perfect. And then started all of a sudden 8 years later, it's in the wrong place. This is not true. The filler's moving. It's percolating. It's coming from the deep and it's coming to the superficial into her orbicularis muscle. No question about it. When I did her actual surgery, I found bits of filler, not a ton. Sometimes I get to the scarless approach to the lower lids in the filler. In my journal, I talk about copious amounts or it pouring out at me. This was not the case. I just found little bits of old filler. It was not encapsulated, which is very important. Oftentimes I'll see encapsulated filler from the inflammation that it causes, making a capsule around it like a breast implant. This was not encapsulated. This was free floating filler that came out just like wet sugar, little bits of wet sugar. So we know that it's free to move at that point. It is not encapsulated. It's not bound. It comes out very, very easy when we go to manually remove it, arguing against all that bits that it cannot move. That is just so not true. So I was finding little bits of filler in the plane that it was set in, right on top of the bone, but there was definitely filler in the more superficial tissues as well. And this is the most common I see, is issues with filler in the muscle around the eye, giving a puffiness, a bulging, a lymphatic drainage issue, a kind of bluish discoloration. And I see it all the time. The problem is, from a manual removal standpoint, is that's really, really hard to manually remove. I have seen this in patients who had surgery with me 3 years ago. Things were great for 3 years. They had a previous history of filler. I removed a bunch of it manually when we were doing their procedure. And then after 3 years of really great results, with some filler probably still present because I wasn't able to remove it all, they're getting this percolating effect into that muscle years down the road after filler and years down the road after surgery, which just makes sense because the filler's aging just as it does, regardless of whether there was surgery or not. So you get into this contour change years after surgery, years after filler. This phenomenon happens. It's real. It's filler moving. There's no question about it. It wasn't placed in the orbic and just invisible for years and then all of a sudden visible. It was placed where it should have been, and then it moved into the orbicularis muscle. So when you see this kind of puffiness sitting around some people's eyes after they've had filler, I see it all the time. I can spot it a mile away. We know it's happening. spinning, it's moving filler. This was a long way of explaining that, but it was cool for myself to get to see filler that I put in years and years later and see what it's doing now in the tissue, in real life. I know exactly when it was placed. I know what filler it was. I know where, what, how, everything about it, and it's still present 8 years later in this case, and it was not encapsulated, and it had moved from where it was originally placed. Not to be crazy problematic, but to start to create changes that we didn't like 8 years down the road. The question is, okay, great. Why don't we all just get filler at first signs then and just like ride it out for 8 years? The question is that it's evolving, I think, for all of us. Anybody who says they know this is probably somebody to watch out for, because we really don't know. The answer is, what is the best way to manage this like percolating, moving filler as the filler is breaking down and aging over time? How do we manage it? Because we know that surgery doesn't necessarily just fix it, and it's starting to create problems later on down the road. That's one of the concerns about it. So TBD, something I'm very curious about, paying a lot of attention to. I'm going to keep watching out for. Thanks for listening to a very long explanation of something that really captured my curiosity and attention.